Hello everyone, my name is Vonnel and I am currently working as a registered nurse at Highland Hospital in Oakland. I am going to be presenting for you today my capstone project for the MSN program in Nursing Informatics at Excelsior College. The title of my project is Improving Comprehensive Stroke Core Measure Documentation and Workflow. As all of you may know, stroke is the fifth leading cause of death in the United States and the second leading cause of death worldwide. The most critical factor of caring for stroke patients is treatment and prevention. For stroke patients to have better outcomes, usually would get referred to stroke-certified hospitals, such as the organization that I was working on my project at. The importance of having a stroke center certification is because it improves the quality of care by reducing variation in clinical processes and also provides a framework for program structure and management. At the organization, they recently switched EHR systems from Soaring Clinicals to Epic. In the legacy, such as Soaring Clinicals, they were meeting the clinical practice guidelines for stroke to maintain their certification based on their documentation. However, in Epic, there were several gaps in meeting those guidelines. The issues were that there were lack of comprehensive stroke core measure documentation in the system, as well as missing information that is required to maintain certification. Therefore, the purpose of this project is to maintain stroke certification for the hospital and to identify gaps in documentation and workflow. Many people at the organization are responsible for the care of stroke patients. Therefore, it is important to involve representatives to assess and address the issues to improve the workflow gaps in documentation. The key stakeholders for the project are the stroke coordinator, abstractor, physicians, and nurses. The stroke coordinators have the responsibility of overseeing all operations of the stroke program, including communicating with all stakeholders, holding monthly meetings, and collecting and analyzing data. Stroke abstractors revolves around analyzing medical data in charts and organizing it to be reported to Medicare. Physicians and nurses are tasked with time-sensitive effort to recognize the variable symptoms of stroke, completing a diagnostic workup and collaborating with the team to decide possible treatment options. The opportunity for improvement for this organization will improve stroke documentation and workflow, which will lead to a prescription standardized, evidence-based practice. Also, the overall goal would change nursing practice based on documentation and workflow. To get an idea of the stroke workflow, here's an overall diagram from ED to inpatient. When a patient comes into the ED with an onset of an acute stroke within less than 3 hours, the physician will evaluate the patient, then activate stroke code. Once code stroke is activated, the nurse will draw up labs, document assessment, and vitals. Then the patient will go to CT. CT interpretation is done by physicians or neurosurgery, and interventions is performed based on the findings. If the patient has ischemic stroke, Alteplase is given and the patient will be admitted to ICU. Alteplase is a thrombolytic therapy used to dissolve clots that have formed in the blood vessels. Once Alteplase is given, the nurse will monitor and document vitals and NIHSS, which is the National Institutes of Health Stroke Scale, to measure baseline data on stroke patients during and after Alteplase. For instance, they will document every 15 minutes for the first 2 hours, then every 30 minutes for every 6 hours, and every hour for the next 16 hours after Alteplase. To identify gaps and improve comprehensive stroke documentation, we utilize electronic health record EPIC tools, particularly Stroke Narrator, from ED to inpatient. The Stroke Narrator contains all the review and documentation tools that a physician and nurse need to document a comprehensive picture of stroke care. Also, it provides the staff with the appropriate documentation tools and a timeline of events relevant to stroke care, from the time the patient was in ED to inpatient. Using the Stroke Narrator makes it easier to document data all in one place. All kinds of strokes, such as TIA, ischemic, and hemorrhagic stroke, need to have their care documented under Stroke Narrator. It is important to focus on evidence-based practice that will narrow down the workflow to enhance clinical practice. Based on evidence-based research, improving comprehensive stroke core measure documentation and workflow can improve patient outcomes, care, and safety. The theories I've used that supported this project are Technology Acceptance Model, TAM, and Dorothea Orem's Self-Care Theory. Technology Acceptance Model is an information systems theory that models how users come to accept and use a technology. Dorothea Orem's self-care theory is used by nurses to guide and improve practice. In this case, it can be used to train and educate nurses on how to assess and manage stroke patients. Leadership strategies that were used throughout the project to assure project success and to address issues is communication. Effective team communication goes hand in hand with better performance. Communicating with other team members, committing to excellence, and measuring what it is important for the patient, such as treatment and prevention. After identifying workflow gaps with coordinators, physicians, and nurses, we utilize a variety of educational resources and training to improve documentation. By the end of training, the nurses and physicians will be able to use the Stroke Narrator for stroke data documentation, which will enhance clinical practice. Also, abstractors and coordinators will be able to retrieve data from Stroke Narrator to ensure compliance for stroke certification. Evaluation criteria is used to assess the effectiveness of this project. Pre- and post-training is a common form of evaluating training programs in terms of improving the knowledge of the participants. The post-training is important to assess the learner's perception of whether or not the course helped them attain learning objectives. Also, The participants will have access to tip sheets in the system with step-by-step instructions for clinical staff to document using stroke narrator for stroke care. Lastly, the checklist is a potentially valuable tool to structure reviews using a patient-centered approach. The significance of this project had on the system within organization and identified stakeholders is to maintain stroke certification and improve patient outcomes. Moreover, this project is designed for hospitals providing to achieve long-term success in improving outcomes for stroke patients. Maintain certifications enhances the organization's ability to attract top-level talent, strengthens the community confidence in the quality and safety of care, treatment, and services, and it demonstrates commitment to a higher standard of clinical service. The focus of the nurse clinical judgment is based on quality evidence-based practice. For this project, assessing the improvement in stroke data documentation is important by monitoring compliance checklists and making sure that healthcare staff are better informed and continuously educated on stroke narrator if new updates are implemented. In conclusion, overall, this project was a success. Improvements in stroke documentation and workflow is essential to maintain certification. Based on factual findings that focuses on quality research, enhances clinical practice for stroke. Therefore, with the implementation of the stroke narrator, improves the comprehensive stroke documentation and workflow in the organization.